is Dr. Angela Gucwa. I'm a vascular specialist at Doctors Community Hospital and Doctors Community Surgical Associates. Varicose veins are large bulging veins, usually in people's legs. They can cause myriad of different symptoms, including pain, tenderness. They can have spontaneous bleeding. If the veins get big enough, they can create wounds. But you can also have leg swelling, numbness, cramping. Those are usually the most common symptoms that I hear. The types of venous disease most commonly include either deep venous disease or superficial venous disease. Most commonly, people hear of blood clots. Those involve the deep venous system. The fear of blood clots is that if they move, they can go to the heart and cause a massive strain on the heart. It can be very debilitating. This is most commonly treated with blood thinners. It's usually medical management. Superficial venous disease usually involves varicose veins, but can also include swelling, aching, generalized pain in the legs, difficulty walking. This is usually due to abnormal blood flow. The veins are usually supposed to drain the leg, meaning they move from the feet back towards the heart. They do this by way of special valves that come together. If the valves are broken, blood will go up towards the heart and then it will go back down. Varicose veins are created basically as a little workaround, those areas that are not working correctly. So we typically grade varicose veins or generally venous disease on a scale of 0 to 6. 0 is somebody that has no complaints, and many people are asymptomatic. They may have varicose veins, but they don't seem to bother them. These patients, we don't advise to get any treatment aside from maybe wearing some compression stockings. People can have anywhere from just small varicose veins in different areas of the legs. They can get inflammation in the skin in the lower legs, which may appear thickened. It may appear dark. It may appear dark lower legs. And then probably the most severe patients have actually skin breakdown where they commonly get ulcers around the ankle. Certain people tend to have a predilection for varicose veins. There is a genetic component. I definitely think that obesity can contribute to varicose veins. Pregnancy contributes to varicose veins. But generally, it's not something that people there's not something that people do to cause varicose veins. In terms of prevention, I basically tell my patients to use gravity to help drain the leg, so elevate your legs at night, especially if you've been up on your feet all day, but also wear compression stockings. We usually recommend knee-high compression stockings, which help to prevent the leg from filling with swelling. So it's always important to do a thorough history and physical exam. A lot of times, there's different signs of venous disease that patients may not even be aware that they have. These include thickening of the skin, darkening of the skin, Generally, people come to me and they already include thickening of the skin, things that are bothering them, or swelling that they notice. But again, people can even develop chronic wounds. These are usually located on the inside of the ankle that fail to heal, and they usually can be attributed back to varicose veins. So there's two mainstays of treatment. Conservative treatment includes wearing compression stockings, elevating the legs to help drain the legs, and basically avoiding sitting in a prolonged position for a long period of time where gravity is just allowing that fluid towards the feet, and you don't have the calf muscle pump that's helping move that blood back towards the heart. Over the past couple of decades, we've developed some more minimally invasive ways of treating varicose veins. These are typically called vein ablations. These are typically use different types of heat source to burn the vein. We currently do not have a way to actually fix the veins, maybe one day, but right now by burning the vein, you can divert the blood into the veins that are working properly. I usually think of varicose vein treatment as improvement in the quality of life. Usually patients come to me after they've had their veins treated. They no longer have to wear the compression stockings to get the benefits. Their legs just overall feel better. They no longer have restless legs at night. They no longer have cramping, burning, and usually the varicose veins that were once bulging are no longer tender. And generally, they just report that their legs overall feel much better than before treatment. Venous ablation is minimally invasive. It can be done in an office setting, but I prefer to do it in an ambulatory surgery setting. That way I can give patients a little bit of sedation to make them more comfortable. It's done using ultrasound techniques where you identify the vein in the lower leg. You basically stick the vein with a needle and then basically insert a long tube. At the end of the tube, it's got a heat source. We insulate the vein with lidocaine and other numbing solution, and then we basically burn the vein. The whole procedure takes me about 30 minutes a leg. Patients are able to walk out of the procedure, and usually within just a few days, they will feel markedly better. After venous ablation, you are expected to wear a compression stocking that goes up to the groin level. That's in order to get the best result where you keep that vein. That's in order to get the best result so the area that we burned actually tries to stick together and scar down. After about 3 days, you're able to wear the compression stocking more at your leisure. Some people will have some tenderness, redness over the area of the vein, but it's very important that our patients walk every day. They do not require narcotic pain medication. And then usually 1 to 2 weeks following the procedure, we do get an ultrasound just to make sure that the area treated looks okay and that there's no unforeseen complications. Venous ablation is covered by most insurance plans. Most insurance plans do want you to try a conservative therapy for a period of time prior to them authorizing venous ablation. Most patients are candidates for venous ablation. When venous ablation was first introduced, there was some thought that patients in their 70s and 80s would not be good candidates for the procedure. I think in recent years this has changed. These patients, I feel, actually benefit more. They may have more difficulty putting on the stockings due to arthritis in their hands, or if they're unable to have somebody help them. So really anybody. I don't typically recommend doing these on patients that are non-ambulatory, but the procedure is especially good for anybody with venous ulcers. There are a lot of physicians out there that perform this procedure. I think it's very important to find somebody that's board certified, accredited, well-trained. I personally think that you should find somebody that offers comprehensive treatment. Find somebody that offers to do a procedure but really wants to take care of you as a whole person. We offer comprehensive treatment for arterial, venous, and lymphatic disease. We do this through the help of our lymphedema center, the wound care center, and our ICAVL accredited vascular laboratory. My partner and I can offer both minimally invasive and surgical treatments. The diseases that we most commonly treat, patients on dialysis, blockages in the legs, blockages in the arms, aneurysmal disease, and carotid disease.